you've heard throughout the board today how busy our hospitals are. We live in a part of London that's facing significant population growth, higher than most other parts of London and certainly higher than most parts of the country. And there is a challenge because the ONS data that's often used to inform the health funding formula doesn't necessarily keep pace with London's population growth. The GLA data for London sometimes shows significantly higher growth than you see in the ONS formula, and that poses a problem for us. We can see increased demand on acute hospital services, and we also know that within our boroughs we have the lowest level of general practice coverage per head of population in London as well, and that puts pressure on services despite the huge numbers of additional appointments our local GPs have been able to offer in recent years. North East London is the Integrated Care Board that's written to the council to express their concerns, and Andy shared that with me. The number of patients per GP that are quoted in the ICB's email are very high, more than 4,000 patients per GP. The ideal number nationally is about 1,800, and we already cope with much higher numbers than that in our patch, and that clearly gives cause for concern. I think it is very important that planners and developers take into account the infrastructure needs for people moving into new buildings, including their healthcare needs. Now, Section 136 is interesting. There was a judgment in 2023 where University Hospitals Leicester asked for funding to the acute hospital because of developments in its patch, and that wasn't upheld. But there is a recognition that Section 106 should be used for general practice infrastructure. The theory being that the NHS is a nationally funded system. If people move from one part of the country to another, changes in the funding formula should fall in for the secondary care provision, but there is definitely a role for Section 106 provision in the funding of GP services. So on that basis, I'm happy to contact Redbridge Council to ask about their plans for this development, and to engage with them more broadly about new developments in the hospital catchment area and how we can better work together around this. And I should say this is timely given the imminent redevelopment of the ice rink site opposite Queen's Hospital, where there's a new developer there, about which we're speaking to those developers and to Havering Council as well. And I do think when we see the demand we're facing, we see the pressures primary care around here is already under. I think it's vital that councils and developers pay attention to the infrastructure needs around healthcare of the population. So I will write on behalf of this board to Redbridge Council. We'll bring that back to this group.
Thank you very much.
Thank you very much.
I'll just do a follow-up on it, just because it's interesting. So an example of where they have put GP facility is Bean Park. It is all very well building a facility. Yeah. It is something very different trying to get GPs in, because we've got a significant shortage of GPs under